Hello and welcome to Total Health with Dr. Nick, where, if you're new to my channel, my purpose is to inspire, empower, and motivate you to live longer, healthier, and more abundant lives. In today's video, I want to talk to you about blood pressure. You know, so many of you come away from your doctor's office, you leave there all nervous, all scared because you got that dreaded report that your blood pressure was too high, and you're thinking, oh my gosh, I've got high blood pressure. That means I've got maybe cardiovascular disease, or maybe I've got myocardial infarction coming down the road, or my family's had a history of heart disease, and oh my gosh, now I have it. Well, this video is hopefully to put you at ease that maybe you really don't have high blood pressure, because I'll tell you, most people that come into my office and tell me that their doctors have told them that it's not the perfect 120/80. That's not set in stone, guys. Please understand that. It's not like the 12th commandment was thou shalt have a blood pressure of 120/80. It really isn't like that. If your blood pressure is slightly above that, or even if you're in your 40s or 50s and it's 146/88, that's okay. So sometimes I even question whether people have really high blood pressure at all. Anyway, but if you do, this is going to give you the 9 ways to lower your blood pressure without medication. And I'll tell you, most of us all want to do that, right? If you want to do that, if you want to lower your blood pressure without any medication, naturally, without all the side effects, you want to make sure you watch this video all the way to the end. So I give you all 9 tips, and comment in the comment section. And let me know if you've been scared by doctors telling you your blood pressure is too high. So once again, watch to the very end. Make sure you get every single one of these tips. Also, share it with someone who has maybe a history of blood pressure issues or has a history of heart disease, because it is a serious problem to have if you do have it. But make sure to also, if you like what we're talking about, like, share, comment, and subscribe. And if you want to get in the best shape of your life and you're looking to get on a keto diet because you've heard of all the great benefits of it, please check out down my link below, and I'll get you all the information on it. You can click on that and see if it's a fit for you. Well, anyway, let's go ahead and jump in and get started with this number 1 tip. It's really an obvious one, I have to admit. I'm almost embarrassed to say, but everybody knows just lose some weight. But I don't think you realize just how profound that is. You just lose 10 pounds. It's going to make a profound difference in your blood pressure. Many times, patients will come in after we put them on the keto diet or any other kind of diet, even the paleo diet, or just to get them to start eating healthy and naturally. And next thing you know, their blood pressure is dropping, and they're like, their doctor's amazed. So you'll be amazed how much your blood pressure will drop just by losing weight. Even a small amount can help reduce your blood pressure. You can lose 1 millimeter of mercury with each kilogram, about 2.2 pounds of body weight you lose. So it's very, very significant. Just a little bit of weight goes a really long way. Number 2 really kind of goes along with number 1, because whenever you're losing weight, also exercise can many times be involved. It's not just about changing your diet, but exercise can really push the process forward. So regular physical activity, such as just exercising about 150 minutes a week. And I know you're probably thinking, I don't know if I have 150 minutes a week. That's a long time, Dr. Nick. Well, it's really not as long as you think. If you simply split it up into 5 workouts, it's really 5 workouts of 30 minutes, and that's not much time in the gym at all. You blink and it's over, and you're back in your car and going home. Or you can work out 3 times a week for 50 minutes. And I know a lot of when you go to the gym, you're in there for at least 50 minutes. So it's just really 3 times a week, but it can make a profound difference. You can lower your blood pressure by as much as 5 to 8 millimeters of mercury. So that's also very significant. So it's 2 very inexpensive, very cheap ways, and with 0 side effects, in fact, all kinds of other benefits, to lower your blood pressure just from these 2 alone. Number 3 is fish oil. One of the great things about fish oil is its omega-3 profile. Most fish, cold water fish especially, have a very high omega-3 profile. That means it's very anti-inflammatory. Now, one of the biggest causes of heart disease and causes of blood pressure issues is inflammation in the body. Now, I'm not talking about the kind of inflammation you get when you twist an ankle or twist a knee. That's a very localized inflammation. I'm talking about a systemic inflammation that's virtually all over your body. That's inflammation that we're talking about, and many times it's caused by processed refined carbs, but omega-3 fats are excellent at reducing this. So study after study has shown consuming fish oil, which is high in EPA and DHA forms of omega-3 fatty acids, reduces inflammation in the body. So that's one of the best things you could do, guys, is reduce inflammation, not just from a standpoint of heart disease, but diabetes, cancer, virtually any disease can be tied to inflammation in the body. So this is a big one. Number 4 is add more magnesium in your diet. This is one of the biggest problems we see today, in that there's a chronic amount of people that suffer from low magnesium in their body, and they could greatly benefit from this. Turns out that magnesium is critical for tissues that have electrical and mechanical activity and help with vascular elasticity. So what that means is when you take in magnesium, magnesium has the ability to make your arteries more pliable or more stretchable. As you can imagine, would you have an easier time getting fluid through a straw if the straw was very rigid and tight, or elasticity so that it can stretch and be able to accommodate even more fluid? Well, in our earlier years, our veins and our arteries and capillaries are very elastic. Much more blood volume can pass through. Since we get older, we get hardening of the arteries, or some people get hardening of the attitude. But anyway, you get hardening of the arteries. We've all heard about it. Atherosclerosis, and next thing you know, your arteries are too rigid and you're not allowing blood through. This can beat that. Also, too, magnesium deficiency is dangerously common, resulting in increased risk of cardiovascular disease, arrhythmias, hypertension, and atherosclerosis. Not only that, studies show that restoring magnesium levels reduces cardiovascular disease by 40% and sudden cardiac arrest by 77%. So those are huge numbers. All right, so just by adding magnesium into your diet, you can greatly reduce your blood pressure, risk of cardiovascular disease, arrhythmias, high blood pressure, and all kinds of other problems like myocardial infarction. Number 5 is reduce sodium. Now, we hear this a lot, but why does sodium become such a factor? Well, whenever you know this, whenever you eat, say, chips or something else that has a high sodium content, you start to hold water, you retain water, you start to swell up. Many times your joints start to ache, you start to get tight. You just had a whole bag of chips during a football game, and next thing you know, your joints are really tight. So what sodium does is, because your body is trying to basically dilute the amount of sodium in your system. So when you take in a lot of sodium, your body takes in a lot of water to basically create an isotonic solution. So that means a solution where it's pretty equal amounts or low amounts of sodium compared to water. So you want to keep that low. You use eye drops, same thing. The eye drops you want to make sure are just a reduced amount of sodium. So when you have too much sodium in your system, your body holds a lot of water. When your body holds a lot of water, next thing you know, you have a lot more blood volume for your heart to push around, and it escalates and increases your blood pressure. So just by reducing sodium, you'll hold less water, and it's been proven that it actually can reduce your blood pressure by as much as 5 to 6 millimeters of mercury. So this is another significant one that's really easy to do. Just cut down your sodium, and it's super, super simple. Number 6 is increase potassium. Now, potassium has been shown to really counteract the side effects of the sodium, so they go very well together. Now, a lot of foods that are rich in this are things like avocados, spinach, Swiss chard, sardines, fresh, wild-caught salmon, not your farm-raised, you want to avoid that, broccoli, sardines, like I said, and spinach. Now, if you're on the keto diet, those are the ones you want to stick to. If you're not on a keto diet, then you could also throw in things like sweet potatoes, beets, and peas. But once again, if you're on a keto diet, you probably want to avoid those. But these are foods very, very rich in potassium. I know most people think, well, I'll just eat a bunch of bananas, and there is potassium in bananas too. But you really want to avoid bananas because they're really, really starchy, really high in carbs. So stick with these here, these kinds of things, maybe even some beans. Once again, the avocados. Eggs are also rich in potassium too. So get all these kind of foods in here. Nuts. Number 7, increase CoQ10. Now this is a big one, and why it's a big one because in America, everybody is so afraid of high cholesterol. So they're always taking statin drugs, and statin drugs actually lower your CoQ10 in your body. Well, your CoQ10 is an antioxidant, a very powerful one at that, and it's very, very important for proper heart function. It's very, very important for powering your heart. So if you're taking any statin drugs, which I don't recommend, by the way, anyway, you make sure you're taking CoQ10 also. So researchers report that CoQ10 may have significant benefits for people with cardiovascular disease, from reducing risk of repeat heart attacks and improving outcomes in patients with heart failure and lowering blood pressure. So, once again, You have to take CoQ10. In fact, I would recommend taking it anyway, even if you don't have heart problems and even if you don't have or taking statin medications. This is something good just to take anyway. Number 8 is reduce stress. Now that seems like a really obvious one. Of course, when you have higher stress, your blood pressure is going to go up. We all know that. But maybe start to do things that would reduce your stress, like meditation, prayer, go for walks. I mean, doing things like exercise are great stress relievers because you start to dissipate that stress. Many times I start to feel keyed up and I start to get anxious. I'm heading off to the gym because I know I'm going to come back feeling great. But you can also do things like take baths. You can listen to soft music. One of the things I love to do, and I recommend this to a lot of my patients and my viewers, go on YouTube, right? If you're not on it already, go on YouTube and put in the search bar 528 hertz, okay, 528 Hz. That is the healing frequency. Many people say that that's the frequency of God, that's the frequency of Jesus. Well, anyway, you don't have to be religious or anything to be able to benefit from it because it's a fantastic frequency to where it's very healing, it's very relaxing. So you can get these tracks on YouTube or these videos where it might be 10 hours of it where you just play it while you're sleeping or play it while you're praying and meditating, and it's a fantastic thing to do. I love just closing my eyes, putting on candles, and just listening to that music over and over and over again. It's very, very soothing. Avoid triggers. Now, that's an obvious one too, but sometimes not so obvious that we avoid it. We tend to fall right into that same trap. You tend to fall right into, that coworker who baits you a little bit. Next thing you know, you jump at it. You're like a fish, like, going right for it. So stay away from these triggers. If you know your mother-in-law or father-in-law or spouse is trying to bait you along, don't fall for it, okay? So avoid those kind of triggers. Avoid situations that are going to get you into trouble and raise your stress levels. Focus on issues you can control. A lot of times we're majoring in the minor things instead of just focusing on the things we actually have power and control over. That's a really difficult thing because many times you want to put out the fires and control everything, but the reality is you have very limited control over things, which takes you into this next one, which is perception. Perception, I like to use an equation, E plus R equals O. I love this equation. I give it to a lot of my patients because E stands for the event, the thing you can't control. It's the car accident. It's the job loss. It's the divorce. It's the child who gets sick. It's whatever. It's the event that happens in your life. R is whether you're responding or reacting to it. Yes, you have control over that part. In fact, R is the only part that you have control over because it depends on your perception. You can look at a situation one way where your coworker looks at it a completely different way, and it's going to greatly change your outcome. So you can look at a job loss and go, oh my gosh, I can't believe it. I was with this company for 35 years. I can't believe they let me go. This is crazy. I want to go there and blow the place up, but don't do it. I want to cause some damage, but you know what? The next guy says, I really wasn't happy with the job. I guess finally God or the universe took me right out of it because I wasn't happy. I was just spinning my wheels. I was just showing up day after day, dreading going to work. Maybe now I can actually find the job that I really want to do. I've always wanted to start an online business. I've always wanted to travel. I've always wanted to become a florist or whatever it is. That's one person looking at it completely different than the other person. And I guess you can guess what happens. The outcome is completely different. And you know what it also does? It brings your stress level down. Because whenever you can perceive something differently, that person doesn't talk to you at work or so on. If you sit there and start thinking, what's wrong with me? Am I ugly? Am I stupid? Am I fat? Am I this or that? As opposed to, wow, maybe this person's shy. Maybe this person has had a rough life. Maybe this person has had a history of abuse in their own life and now they're afraid to talk to anybody. So you can perceive things any which way you want. You can either respond or react any which way you want, but it's going to change your outcome, and that's going to change ultimately the way you perceive it, and it's going to help bring your stress levels down. So perceive things in a way that's more empowering rather than this disempowering. Number 9 is limit alcohol. Now, I know that's not such a popular one all the time because people are thinking, hey, Dr. Nick, the alcohol is what helps with my stress. That's the one that helps me with this whole thing. But you know what? And there is some truth to that. Alcohol in little bit amounts can actually be beneficial. Studies show that. My wife's grandfather is about 97 years old, and he always used to have a little Johnny Walker Black. My Aunt Mary Cipollone, that's a nice Italian name, huh? I remember going and visiting her in the streets of Jamaica, Queens. When I was growing up as a kid, I went to her house, And this lady was feisty. She was in her 80s at the time, I think about 85, and she's out there with a broom wiping down her house and hosing it off her house, not her car, not her porch, the house. And I couldn't believe it. She goes inside and she's like, "Hey, Nikki, you want something to drink?" And I said, "Okay, sure, I'll have something to drink." She goes, "Hey, you want a little scotch?" And I don't drink scotch. To this day, I don't like it very much. But she's opening Johnny Walker Black. And I'll tell you, in some cases, a little bit of alcohol is actually okay. But the problem is when you drink it in above moderation, when you go way above that. So what it shows is when you drink it in moderation, you can lower blood pressure by about 4 millimeters of mercury. However, drinking more than moderate amounts of alcohol can actually raise your blood pressure by several points. And we know that. So guys, watch out for that. Enjoy your alcohol, but enjoy it in moderation. And if you're on a keto diet, I did a video on that. You want to check it out and see what alcohols are actually good for you. So I hope this is good information. Do any of those tips. Do 5 of them, do 3 of them, do all 9 and see what happens. Watch your doctor just blow up. He's going to be like, "What are you doing? I can't believe it. You didn't need the medication anyway." And isn't that a great thing to be able to lower your blood pressure without medication? And that was my purpose of this video. So hopefully I put you at ease a little bit. Hopefully you watch to the very end. And hopefully you like, you share, you comment, and subscribe. And also too, hit that little bell notification so that way you get notified anytime I make a video. So anyway, guys, I love and appreciate you. Thanks for joining me today. This is Dr. Nick, and I will see you on the next video. Bye-bye.